It's on, Bill. It's got a skyline of the city of Rochester. Skyline of the city of Rochester.
All right, we're live.
Good evening. I will begin this evening's program with a message from the mayor.
Good evening. I'm Mayor Lovely Warren, and I'd like to thank each and every one of you for taking the time to join us tonight. As many of you may have heard, we've changed the name of the Department of Recreation and Youth Services to the Department of Recreation and Human Services. And within that department, we've created the Office of Crisis Intervention Services. The goal of the office is to create a comprehensive, community-based response to support victims and families dealing with homicides, mental health, domestic violence, and other related issues. There are many in our community who struggle with mental health challenges. They and their families often don't know where to turn. They may not even know that help is available, or even how to access it. We are here today because of them, but just as important, because of you. And now we need your input in order to move forward. In just a few minutes, you're going to hear from Dr. Danielle Lyman-Torres, Commissioner of the newly renamed Department of Recreation and Human Services. Dr. Torres is going to introduce Aaliyah Hinton-Williams, the new coordinator in the Office of Crisis Intervention Services, who has been working diligently to get the new teams ready to launch. This office is comprised of the Family and Crisis Intervention Team, the Victims Assistance Unit, the Homicide Response Team, and the Crisis Response Team. Some of these functions have been moved from the Rochester Police Department. With these incredible, dedicated, and powerful women at the helm, we will take these services in a new direction and affect true change in our community, all while being transparent. So please, ask whatever questions you may have tonight, and thank you for your time and effort and dedication. Turning it over to you, Dr. Torres.
And I am going to go through the agenda for this session, information session. I intend on introducing the team, as the mayor alluded to. I will provide an update as to where we are with the Office of Crisis Intervention Services. You can ask questions throughout in the chat. We will do a Q&A, and at the end, I will make sure that I provide contact information for you to continue to ask questions, provide input, or suggestions as we go along. First, let me introduce the team and introduce myself. The mayor turned it over to me, but I am Danielle Lyman-Torres, and I am the Commissioner of the Department of Recreation and Human Services. I also have on the panel Erica Hernandez, who is the Associate Director of Community Services and Administration. Aaliyah Hinton-Williams, who is our Comprehensive Crisis Response Coordinator. We may be joined by Vice President of City Council, Willie Lightfoot, who is also a member of this team. We are joined by Councilmember Mary Lupian from the East District. We may also be joined by Councilmember Lachey Harris from the South District, who is also a member of this team. And we thank Ray Mayalese, who is serving as our moderator this evening. So as the mayor stated in her message, I'd like to start off by making sure that we provide information on what we are doing and what's the goal for this new Office of Crisis Intervention Services. But very clearly, our goal is to create a comprehensive community-based response to support victims and their families who are dealing with homicides, mental health, domestic violence, and other related crises. When we mobilize highly trained professionals, we can deploy more effective ways and connect people to the services that they need. We know that there are many providers and individuals trying to make a difference in services that are available in our community, but we want to organize and coordinate our efforts in order to have meaningful impact to move toward change. It's important that people understand that we are a part of a large system. So the City of Rochester Crisis Intervention Services Office is a part of the system and connects in every way. Monroe County Services, which include the Office of Mental Health and FIT, is something that we have heard a lot about in the news as well. And we are a part of that system because the City of Rochester is in the county and we do work together on providing services to the community. But there are other layers of service providers that also make up this network beyond the city and beyond the county, which includes a wide network of community-based providers that we do connect people to on a regular basis. We also have the health systems. Most often people think of connecting people in crisis directly to the health system, and sometimes that's the case. But other times it makes sense to connect people to community-based providers along the way or in conjunction with the health system. And the systems that feed into this connectivity include 911 and 211 Lifeline as ways that people access the services, as well as public safety, which has long been a part of how people access the services, whether that be police, fire, or EMS. I will talk about now the Office of Crisis Intervention Services because there are 4 distinct programs that make it up. Often we've been hearing words interchangeably, using words and the acronyms that we have, such as FACET and the county's program, which is FIT. These programs are not interchangeable. They are discrete and unique programs, some of which have been around for many, many years. The Family Crisis Intervention Team and the Victim Assistance Unit are programs that have been a part of the Rochester Police Department. And when we made an announcement a few weeks ago, City Council voted and moved to relocate those programs into this new Office of Crisis Intervention Services. But their work continues to be the work that was outlined for their programs, which is crisis counseling for victims directly after the incidents have occurred, being able to assess and connect people to services, and serving as short-term case management while the follow-up and connectivity to services happens in the community, which we know can sometimes take time. The Victims Assistance Unit also has a specific charge. They work with people who have been victims of crimes, and largely crimes that may have to do with domestic violence or other family crises, as well as homicides. And what they do is they support the families, the community around the victim, and they do that by connecting them to resources such as financial resources, support with court support, as well as connectivity to the variety of grant programs that exist for people who have been victims of crimes. So these 2 programs, again, have existed in our community, but make sense to be a part of our Crisis Intervention Services Office because we're changing the way we connect people to service. And we're making sure that we do that in an alternative approach, which is a non-law enforcement driven approach, but a community-based approach. The 2 new components of this office include the Homicide Response Team, which is a 4 to 6 member team that will respond to each homicide to support families of victims and connect them to the services that are either provided by the Family and Crisis Intervention Team or Victims Assistance, as well as some other providers in our network. The team will also support neighbors with grief services and mediation to prevent retaliation or continued violence. I'll talk a little bit more about that team in a moment as well. The crisis response team is the fourth part of the office. And that part of the team is going to be focused on an alternative response model to mental health, domestic violence, and other identified crises. There will be a team that responds to these crises and calls in the city of Rochester, and that team will consist of emergency response social workers and EMS. We have been working on 911 and 211 lift line dispatch protocols, team training, and a comprehensive advisory committee has been doing work that is very detailed and very specific on protocols that need to be put in place in order to have this response team model ready to pilot. So I want to dive a little deeper into the homicide response team. That team comes from the work of the Rock Against Gun Violence Coalition. And the Rock Against Gun Violence Coalition has been meeting for 2 years in regards to the needs for the community and the needs that are specific to responding to homicides, and wanting for these needs to be met in a coherent and comprehensive way. Some of the members of that team include the Rochester Police Department, Pathways to Peace, SERVE, which stands for Community Engagement to Reduce Victimization, which is a program out of RIT, Rock the Peace, Rise Up Rochester, Save Our Youth, and the Rochester Youth Violence Partnership as a part of U of R. So these groups have been meeting to discuss this and meeting to get together and coordinate how we will respond together to ensure that the services are provided and that no family says that they haven't had a response from the community when they've lost a loved one to violence. The crisis response team, I want to talk a little bit about where this is coming from and the inspirational models that have been viewed as a part of the development of what will be the Rochester model. So we have looked at models from across the country, most notably a model that many people have heard about and been speaking about in our community, which is called the CAHOOTS model out of Eugene, Oregon, run by the Whiteberg Clinic. This model has been enacted since 1989 in Eugene, Oregon, and so they have a great deal of information on how it has worked in their community. Some of the things that we have learned from their model that we are working through as we build our model is the partnership with the clinical personnel who are the social workers, as well as the EMS partners, being the team that responds. We've also looked at what the city of Portland is working to do, which is a street response model that's very similar and to what CAHOOTS has done in Eugene, Oregon. We've learned about the 911 diversion, which has happened in our own state. And we've continued to look at cities like Austin and Houston, who have pieces of models that make sense to adopt in a larger city like Rochester. As I mentioned prior, we have formed a comprehensive advisory committee. The county has also formed an advisory committee. We share members on these two committees, I sit on both committees, and we are working well to coordinate the efforts that we are doing, in particular, the efforts around 911, call screening, and call diversion, because this is a shared service between the city and the county, and our protocols will be important that we match up and are complementary. We also have a team that is specifically looking at our response team protocols and training. What will the team do? How will they get on the scene? What will they do when they arrive? And what training will be required of these team members are all critical pieces that this subcommittee is working on. And then the third leg of the stool from this advisory committee is looking at the care network, making sure that we have a network of all of the providers categorized in a way to connect people so that we have made these connections as a part of our system. So we have a number of people working on the level of detail that's required to be able to launch this comprehensive crisis response team. So I want to take a minute and talk about the path forward for each of these. The first is looking at what is happening with the Family Crisis Intervention Team and the Victims Assistance Unit as they transition. So the transition of these programs to the Department of Recreation and Human Services will be officially completed by October 26th. They will continue their current work, and there will be a relocation of these services from the Public Safety Building to 57 St. Paul Street, which is where the Department of Recreation and Human Services has its headquarters and administration, as well as program offices. This location is centrally located and is located directly across from the RTS Transit Center. We have located there for convenience of our community members and access in a way that is accessing a non-law enforcement establishment. The Homicide Response Team has already started its training. And that team, because of its long lead time and planning time, as I mentioned earlier, will be ready to launch in November. The Crisis Response Team, there are many steps that we need to take to complete the development of a pilot plan. But we have hired initial emergency response social workers, and the advisory committee has been hard at work and continues to be hard at work on plans, and they have a timeline to complete a pilot plan by a 90-day mark, which is the end of December. So we have a clear path forward on how we're moving, and we wanted to provide this update. But I also want to call attention again to the fact that while we will take questions and answers in just a moment, we may not get to all of your questions, and we may not get to everything you think of right now in this webinar. But we have provided on the screen an email address, which is crisisintervention@cityofrochester.gov. Again, crisisintervention@cityofrochester.gov. So please do take the opportunity to email if you don't receive an answer to your question, and we will take those questions as they come in, and we will respond as we can to those. Also, I would like to encourage you to go to the website, which is cityofrochester.gov/crisis intervention, where we will continue to post information, updates, and have a link to this email address for continued correspondence. At this time, I would like to turn it over to the moderator to propose a question to the panel.
Good evening. We have a slew of questions that have already started to come through. And I am going to start with Amber Noel of Agenda Us Now to all panelists. Commissioner, how involved is the county legislator on this new team in relation to new laws for systematically affecting single Black mothers via CPS and family court?
I'm not sure what the connection is in this regard. We have not had conversation with the county about that, but that is something that we can have conversation with the county with. But at this time, we have not had a conversation with the county about that specific question that you posed.
Okay, we have a secondary question regarding the launch of this town hall session. Instead of 2 days of notice, is there any way better to promote these meetings, giving people ample enough notice for these discussions?
I think that this is the first of our conversations, the first of many. So there will be many opportunities for us to continue to have engagement and provide updates. We wanted to make sure that we provided an update as close to when we made our announcements as we could. And so that's why we're having this session today. But we do want to make sure that we have additional update sessions in the future, and we will take note that we can provide more lead time for these sessions.
Thank you, Commissioner. If there's an area that needs to be met that this team is currently not meeting, will this current team be collaborating with constituents and other consulting alliances to bring forth sufficiency on those discovered neglected areas?
We will continue to bring people to the table and have conversations as this develops, launches, and as it's enacted, because it's going to be a community-based response. And so the community involvement in the response development, in the response evaluation is critical. So again, this is one step in that, which is having an update. But the other piece of it is the advisory committees that we have in place are made up of the community. They're made up of community members, and we want to continue to expand that. So as we learn of more groups and more organizations that need to be at the table and need to be heard, we will engage them in the conversations, which is another reason why we wanted to do the outreach tonight, to provide information on where we're headed so that people who think there is synergy with what they have to offer or what they do can get connected to us now.
Thank you, Commissioner. I have a question from Jordan Guldani. Will services be accessible, not just the building as far as wheelchair accessible or accessibility for the blind, but what measures will be in place to make sure the most vulnerable are served and supported?
Well, accessibility is important, and we will make sure that we bring this to the committee so that when the plans are being developed, that is one of the principles that they hold as they develop these plans, that they're taking a look at these and looking at it from a lens of accessibility. We've been looking at it from a lens of both equity and access, but using the term accessibility brings a different point forward. And we will make sure that the advisory committee has that as a standing principle.
Will there be access to specific resources for those with disabilities, or do you believe it will be a blanket one-size-fits-all approach?
Again, we believe that the community is rich with a number of resources that support people in many different populations and many different population groups. What we need to do is coordinate that and link that together. And so we don't intend on establishing new services. We intend on connecting people to services. And we believe that services that support people of all abilities exist in our community, and we need to make sure that we connect residents to them as they are facing crisis.
Okay, we have another question here. How and who will be doing intake?
So if I'm understanding the question of intake, the way that we're going to do it from a response standpoint comes back to our conversation around how the calls come in, whether they come in through 211 Lifeline or 911, there's going to be an assessment process. And so that assessment process will either be delivered by or developed by clinicians. And so that's how the response team will be enacted.
We've got a question from Matthew Pettit. Do you have people on the advisory committee from the community who are in recovery from mental health related issues who may have had criminal justice involvement? Is there transparency about who is on the advisory committee and how they were selected?
So to answer the first question, we have been discussing at length the peer model and peer navigation of the system and the importance of linking peers at all levels of this crisis response. So we do have that as a part of our program development. We will develop our web landing page based on feedback we received tonight, and we will list who we have involved in the advisory committee. We will also list organizations that we have spoken to, who we've gotten information from. And again, as we get more input from you, we will continue to have conversations with organizations and people who should be at the table.
Okay. Thank you, Commissioner. Will there be any specific team for child and adolescent population?
So our team will respond to all ages. However, who we connect them to will be specific based on age and service type. So there are services that are specific for children and young people in crisis, and those are the services that we will establish in our care network to connect youth to.
Thank you. Someone asked earlier, what does CAHOOT stand for? It stands for Crisis Assistance Helping Out on the Streets, and that is CAHOOTS. Next question that I have for you is, how are you coordinating with the Race Commission? They have had listening sessions. So how are you coordinating with the Race Commission?
So that's a great question. The Race Commission, which is a combined effort, again, with the county and the city, they have a charge that's an overarching charge to look at equity and access in the community. I believe their listening sessions are targeted at that. I have listened to their session on mental health services, and we are incorporating what we hear in those sessions with the work that we're doing. So we are listening to those sessions. We have been engaged with the Race Commission in that way. We know that the Race Commission will look at the model that we develop as a part of their scope of work, and they will look at it again through their lens, which is equity and access.
Right. Will individuals be provided resource connections for continuing supports?
So that's a great question as well, because many times case management and care management has been short-term when people need long-term support. So part of what we will be doing as we build our care network is making sure that we have a system that can provide long-term case management and not just the short-term case management that we have as a part of the services that we currently offer, but we know the community has long-term case management, and we will make sure that we are making those connections, following up, and ensuring that people who are linked to services and who choose to follow through with that get the services that they've sought.
Thank you, Commissioner. I've got a question from Paul Clark. Good evening, Paul. Was the Rochester City School District invited to the table to plan these services as they are a key partner?
We do partner with the Rochester City School District in many ways. And I think that based on feedback that we're hearing about youth and the connectivity to that, we will certainly invite them to participate to what level they think is critical, because there may be instances where we do indeed have to provide, emergency response or crisis response to a school, at a school, or with students and families from a school. So we will reach out to the school district and ask them about their interest in participating.
Have you coordinated with the domestic violence advocacy community?
Yes, we have. We do, again, have members from domestic violence support organizations on the advisory committee. And we will make sure, as I said earlier, we will have the domestic violence as well as all of the types of committee members listed on our web landing page as a result of the feedback that you are all providing us this evening.
Commissioner, have you involved the people that are currently doing these jobs in these professions for their input as we move forward with the new office?
Absolutely. People who have done the work understand the logistics, understand the challenges, and understand what families and people in crisis have experienced in the model that currently works. So they know how people have experienced being connected to services. They know the challenges with that, but they also know what works successfully and how they've been able to have successes with connecting people to services. So we want to learn from their experience, both things that have worked and things that can be improved in this model.
How can we, the community, help educate the community to be aware of crisis situations and know where to call for help?
Aaliyah, our coordinator, would you like to answer that question?
Sure. I think that as we move forward and we establish more and more of our procedures, particularly around where people will be able to connect, who they'll be able to call, we'll make certain that the community is well aware of how to access any type of services and resources. And that's going to be a big part of what we do in general. What we're doing is based on community need. And so the community has to be involved with the process as we move along, and they need to be kept aware of what's happening. And we'll make sure that that happens through the information that we disseminate throughout our community.
Thank you, Aaliyah. What is the communication plan to city residents and emergency personnel staff?
I'm sorry, can you repeat that question?
What is the communication plan to city residents and emergency personnel staff?
Well, we will make sure that that's a part of what we develop in our pilot plan. I think what you've seen today is that we want to make sure this is a community-based conversation. We're having conversations now. We know that it takes more than one conversation. We know that it takes more than one training for people to understand in the system the changes that are happening to the system. This is a major change to a system that's been in place for some time. And we need to make sure that not only we're communicating, but that we're doing training, because it's imperative that there's training not only for the people responding, but the people who support the system, the people who used to respond in the system, meaning law enforcement, need to understand what the new system is going to be. And then mostly the residents need to understand, what are the new services? How do we reach them? How do we access this? How will this be enacted, and what can we expect, so that we can make sure that everyone knows how to enact the system when they need to.
Commissioner, we have another question from Amber Noel. Will there be any future panels where constituents are able to chime in firsthand on their issues?
I think that we will definitely ask for opportunities to chime in on specific issues. I know that there have been general listening sessions that have talked about people's experience with the system as a whole. For the work of this developing team, it's going to be very important that they seek feedback from people who've experienced the system on specific portions of the system that they have experienced, so that they can use that input. For example, when the homicide response team was putting together its plan, there was a lot of conversation with victims of homicides' families to understand how they had experienced the system and what they would have benefited from if the service delivery model was different. And also what they did get from the service delivery model that they found to be a benefit. So that part of the work did happen for the homicide response team, and will most certainly be a part of the work for the development of the crisis response team. So thank you for that question, because that is a very important part of the work. Just as we talked about peers, we need to make sure that people who have experienced the system have a specific way to give their feedback.
Do you have clinicians who are currently practicing in the field on the planning committees?
Yes, we do.
Okay. For mental health related crisis response, why have I not heard about integration of a culturally responsive community peer approach?
So I think we talked about peers in an earlier question. We have been contacted by peer navigation groups as well as individuals who want to be a part of making sure that peers are in our system and part of our network. And we have a commitment to having peers in the structure of this response team.
Mary Lupian would like to add to that response. Is that possible?
Absolutely.
Mary?
Yes. I was wondering if you could address the culturally responsive piece to that question. I know that you've made some efforts to make sure that the response crafted is going to be culturally responsive.
Absolutely. So one of the things that we have heard from the community is that the responders and the service model that has been in place has not been culturally responsive. So the team that will be in place will not only look like and reflect the community, but will also be trained in culturally responsive, trauma-informed care. And that is very important. And so thank you, Councilmember Lupian, for bringing that forward, because it has been at the forefront of our response to what we have learned from community members who have experienced services and crisis response in this community as it stands.
Commissioner, we have another question from Michelle Cater-Corot. How will the domestic violence victim be able to file a police report on the scene if the crisis intervention team responds instead of law enforcement?
Well, just because law enforcement isn't the first responder doesn't mean that they won't be called to a scene. So if law enforcement is needed, law enforcement will be dispatched. So we want to make sure as we build the protocols, people don't see things as mutually exclusive. While we are building an alternative response, there is a place for everyone in the system. And so where the system needs the right response, that response will be provided.
Thank you, Commissioner. Will you have female response specifically as well?
Aaliyah, would you like to take that question?
Absolutely. We're going to make sure that those who are involved, again, represent our community, and that they are diverse and that they can meet the needs of whoever might need support and resources in that moment. So if that means it's a female, then that's who will respond.
Are there any collaborations with Willow, Aaliyah, at this time?
Yes, we do have a collaboration with Willow. Absolutely. That has already been something that has been longstanding, and we will continue to work with them.
Thank you, Aaliyah. Has the library director or library staff been involved in the planning process?
The library director has been fully briefed on the Crisis Intervention Services plan, and library staff are welcome to provide further input on how we might be able to support their work and how they might be able to support connecting residents that they interact with to services.
Mary Lupian would like to add to that response.
Absolutely.
I think you're maybe seeing me taking care of the questions in the Q&A box.
Oh, okay.
I agree with you, Commissioner Torres.
Okay, thank you.
When you say social worker, Commissioner, what do you mean by social worker? What level of social work are we talking about?
We're talking about master's level social work, but also related credentials such as licensed mental health counselor, LCSW, LMSW. So there are a number of attributable credentials to this work. So that is what we mean by social worker.
Okay. Where does response to sexual assault fit into this plan?
It depends, because when using the word sexual assault, that's a crime. And that is something that a crisis response team would respond to in addition to law enforcement to connect to services, but not as the sole or first responder to something that is, that level of crime. But there is going to be a connectivity between everything that we do. As I said before, it's not going to be mutually exclusive. While there will be instances where the crisis response team will respond first, there may also be instances where the law enforcement responds first and enacts the crisis response team based on what they see. That's going to require training. It's going to require protocols. And those are all things that we're talking about right now.
So that's a good segue to the next question, is what role will the Rochester Police Department play in these teams?
So they play a role in this whole process. So they'll continue to play a key role in connecting victims to victims assistance and to family crisis intervention. They will also continue to play a role in the homicide response team. They will call the homicide response team. That is a leg of this office that would not respond first, but would respond after being dispatched by RPD. And we do have conversations with law enforcement and have members of law enforcement on the advisory committee for the development of the crisis response team. So RPD, law enforcement is a part of the planning, is a part of the conversation, and has to be a part of every leg of this in some way.
What constitutes a crisis? Who makes that decision during an initial crisis call?
So earlier, one of the things that I wanted to be clear about saying is that there's definitely a role for looking at what clinicians will be doing screenings. So there's an assessment that has to happen. And there's an assessment that happens in every community that has a community-based response. And that assessment is built on protocols based on the type of calls, the type of situation that is described in those calls. And that's something that the professionals that we have at 911 today, they do this every day. We will be adding to protocols and adding to training, but this is something that public safety professionals do every day in making assessments. So we're not going to take that step away. There is going to be an assessment, and there will be categories on types of calls that the crisis response team responds to first, and types of calls that the crisis response team may be brought into at a later time.
Okay. Will the crisis response team be the liaison if the crisis individual asks for mental health, arrest, or other? Will they be the voice for the crisis person?
So the crisis response team's goal is to serve the person that's in crisis. And it's a person-centered approach. And so the assessment of what to do to support the person best will be made by the clinician that's on the scene.
Okay. Due to time constraints, I'm going to take two more questions. I'm sorry. Do you have the resources to put the model in place now?
We will be assessing that as a part of this pilot development plan. We know that we have added resources. We know that we have arranged for resources to be a part of this team, but we don't know if there are more resources we will need until the team has finished developing its pilot plan. If at that time we need additional resources, we will make that known. We will say, this is what the plan is going to require, and this is the gap if there is one.
Okay. Could you refresh the community again as far as when the teams launch?
So the homicide response team will launch in November, but the crisis response team will complete its pilot plan by the end of December. And so that's the timelines that we are working on right now for both of those teams.
Okay. Last question. How will this team follow up as people do get lost in the systems?
Aaliyah, would you like to answer that, please?
Well, a major part of what we're going to be doing is developing a long-term plan for those who we respond to, because we are well aware, and that's a very true statement, that people do get lost in the system, or people just get lost in the shuffle of whatever is happening. That's a key piece of what's going into this plan, to make sure that it's not just a one-time interaction with an individual, but that that person receives all of the care that they need in a holistic approach that's going to make sure that we don't have to continue servicing them in the same way. Because if people don't get what they need, they continue to need help, and will continue to come into contact with them, which is not what we want. We want to make sure that people have the services and resources needed, and that will require assessments and planning.
So that is our time at this point in time for questions on Q&A. I'm going to pass it back to Commissioner Dr. Danielle Lyman-Torres to close us out.
Again, I would like to thank everyone for tuning in to listen to the update, but also asking very thoughtful questions. Those we have captured, we have taken note of the things that we can do to increase our communication with you, to make sure that we are sharing who's on the teams and how different members can be connected, different groups, different individuals. So please do, once again, go to cityofrochester.gov/crisis intervention, as well as check out crisis intervention at cityofrochester.gov for emails, and let us know if there are additional resources that we can add as you see what we're doing. This is the first of our conversations with the community. We will continue to keep the community updated as these plans develop. And we thank you for your time. We thank you for your commitment to this service, and we thank you for your commitment to our community. Thank you.